Well, hey anatomy, hope you're doing well when you watch this video. Hope you're having fun, online education, and at peace. I hope your family's well. Today, I want to talk to you about the last part of the lymphatic system. The objectives for this video, I want to help you identify the classes of lymphocytes, discuss their importance, and describe their distribution in the body. I hope to describe lymphoid tissues, and we're going to trace the lymph flow through a lymph node, and then describe anatomy and function of the thymus and the spleen, major organs in the lymphatic system. So first off, lymphocytes. Lymphocytes are responsible for the immune functions, protecting you from the outside world. So lymphocytes make up 20 to 40% of circulating leukocytes. Leukocytes are white blood cells. Most lymphocytes are out in lymphatic tissue. So there's different classes. First off, there's T cells, cell-mediated immunity. We'll learn more about that when we talk about the immune system. B cells are antibody-mediated immunity. We've heard a lot, maybe in the news if you pay attention, about antibodies and some patients that have survived COVID-19 using their blood, their plasma, because their plasma will have antibodies against the virus to help people recover. Again, we'll talk more about that down the road. NK cells, which literally mean natural killer cells, they're like the surveillance. Lymphocytes, all classes of lymphocytes are sensitive to specific chemicals. These are called antigens. Antigens could be pathogens, foreign proteins, or abnormal substances. If you have bad allergies, those are antigens, and your system just over ramps that response to that antigen thinking it's dangerous, and it's really not. It could be like just pollen or cat fur or something. Antigens stimulate an immune response. So again, we're trying to target this for destruction. So T cells, there's different types of T cells. They're cytotoxic, which means toxic to a cell. They attack foreign cells or body cells infected by viruses. So again, bad cells in our bodies need to die. Cytotoxic cells take care of that. Helper T cells, they stimulate activation and function of T cells and B cells. So these cells go through like a differentiation process and they have to be activated. And helper T cells do that. So if B cells are producing antibodies, they have to become activated before they do that, and T cells help them. Regulatory T cells moderate the immune response, so they help establish and control sensitivity. So therefore, sometimes when our immune system over ramps up, like septic shock and various things like that, regulatory T cells are going like berserk. And so they moderate the immune response. They tone it back. Sometimes our immune system can be very aggressive. So they're like, hey, let's tone it back a little bit. Memory T cells help us remember. This is how vaccines work. Memory T cells respond to antigens they have already encountered. As far as B cells go, they become plasma cells that produce and secrete antibodies. So antibodies are these proteins that stick to foreign substances. They circulate fluids to attack targets throughout the body. So, and then natural killer cells, they attack foreign cells, virus-infected body cells, and cancer cells. They are constantly monitoring your body. It's pretty crazy that you have a cell inside you called natural killer, but your body doesn't play around. It really is designed to protect you and to help you live, which is great. God is a God of life, and He, of course, gave life, Jesus, when He was on the earth, to people who were sick. So God is all intelligent, creator, all knowing, and He knew what we needed before He created us. So, uh, lymphopoiesis is like lymphocyte production. So where does these things come from? Where do these lymphocytes come from? Well, they come from red bone marrow, and the thymus is involved in peripheral lymphoid tissue. So red bone marrow plays a primary role because this is where development happens. So let me show you a picture right here. So you can see the red bone marrow, and this is all this fancy, stem cell kind of cells. Like if you're going from a stem cell to a very specific cell, there's levels of differentiation. And so you have this cell right here, and it can differentiate into lymphoid stem cells or lymphoid stem cells that are going to go B cells or NK cells. The thymus, the T cells are created or helped to specialize in the thymus, hence the name T cells. And then B cells and NK cells, B cells are antibody mediated and NK cells are your surveillance. T cells are cell mediated. So they attack cells, antibodies versus immune. So those three types of cells you need to know the difference of. So here are some questions to consider. I would like for you to answer these for me. Identify the three main classes of lymphocytes. What tissues are involved in lymphopoiesis? And then what cells are responsible for antibody-mediated immunity? Okay, continuing on, we have lymphoid tissues. So we have our cells. Now let's look at tissues. Tissues are dominated by lymphocytes. We just went over those. They have reticular fibers in them, and the nodules have a germinal center. Let me show you a picture to help you understand this. These are your tonsils. Some of us, I'm not sure if anyone in this class, but I have heard, talk to people who have had their tonsils removed. They kept having a lot of sore throats and sicknesses, and eventually they're like, man, we just need to remove our tonsils. But your tonsils are lymphoid tissue. And so you can see right here, this is underneath a light microscope, 50 magnification. The germinal centers, this is where a lot of lymphocytes gather. And okay, so you have like the, epithelium, the covering tissue, and then the germinal center. So there's different types of tonsils, pharyngeal, palatine, and lingual. So let's go back here. So pharyngeal's right here. Palatine's kind of at the, which is kind of the ones that are removed often. And then the lingual are right there, of course. And so types of nodules, we also talk about mucosa-associated lymphoid tissue, MALTs. They are associated with the digestive tract. The tonsils, there's 5 sets of tonsils. You need to know where they are and what they're called. And then aggregated lymphoid nodules, they're associated with the small intestine. So here's a picture of a tonsil being removed, sorry. And I'll put a link in the description about a tonsil removal surgery if you want to see it. Some of you may, some of you may not. But here are the tonsils kind of. This is, again, the palate's been cut away so you can see, where the pharyngeal tonsil is. Palatine tonsil, sometimes they'll look in your throat and see if they're swollen or not. And then the lingual tonsil is behind the root of the tongue. Lymphoid organs. So the organs are lymph nodes. We'll talk about those first. And then the thymus gland and the spleen. So this is a picture, interior view of a dissection of the inguinal lymph nodes and vessels, so near the groin. So you can see there's like these lymph nodes. And if we dissect the cat, or if you ever do a dissection, you'll see these like lymph nodes in the dissection, okay? So here's your large femoral artery, and lymph nodes are right there, housing lymphocytes, being that slow kind of checkout lane, seeing what's inside the blood, protecting us. Here's just another picture here of all the lymph nodes inside the mesentery of the intestines. Again, those lymph nodes protect us in case we ingest something dangerous or have something dangerous traveling through our body. Lymph nodes are major sites of B and T lymphocytes and other white blood cells. Lymph nodes are important for the proper functioning of the immune system, so they're crazy important, acting as filters for foreign particles and cancer cells. So again, here's a lymph node. Sometimes they're swollen, so that's when that doctor, like I told you, that doctor kind of feels right here when you're sick. What is he feeling or she feeling for? Swollen lymph nodes, because if they're swollen, you're probably dealing with some sort of infection. The condition of lymph nodes is actually very important in cancer staging. So stage 4 cancer has spread. Stage 3, there's different stages of cancer, and I've known someone who, when cancer's in the lymph nodes, that's oftentimes, unfortunately, a very bad prognosis because the cancer has spread and is spreading through the lymph system and to other parts of the body. So it's very important. So if they cut away the cancer, they'll take lymph nodes with it, and they'll see if those lymph nodes have become infected with the cancer. Very important for oncologists and doctors to help people live by seeing lymph nodes. So they're small, 1 to 25 millimeters, and they are scattered throughout the body, but there's high concentrations in certain areas. So the cervical region, which is the neck, axillary, which is the armpit, breast, abdominal region, and inguinal region, which is the groin. Now, the lymph node actually has this general structure right here. So you can see right here, this is what they look like. And then this is one of them dissected, of course, zoomed in. And you don't have to know all this, but I would like for you to know the general flow of lymph through the system. So we start right here. Afferent with an A, going towards the lymph node, okay? Then we go to the subcapsular space, outer cortex, which is where B cells are, pericortex, which is where T cells are, medullary sinus, which is where more B cells and plasma cells are, and then finally we leave through the afferent lymphatics back into the venous system eventually. And so know that general flow of how the lymph flows through a lymph node. That would be important to know. So yeah, they defend us. Lymph nodes defend us against bacteria, cancer cells, virus-infected cells, and damaged tissue, trapped by reticular fibers, and also helped by those immune cells that we already sort of talked about. I give you a picture here of a gentleman reading the Bible, and it's found in Ephesians about the armor of God, right? The helmet of salvation, the sword of the Spirit, and we're under attack every single day. We're under attack by our own thoughts, our own doubts. Satan and his army is coming for us. And so much like the lymphatic system protects us, we also have to choose to input thoughts and truth into our hearts and minds to protect us against the flaming arrows of the evil one. And so please, guys, I plead with you, be in God's word, especially during this hard time, uncertain time, stressful time, different time. It's all sorts of adjectives, but it's tough right now. And so I plead with you, be in God's word, fill your mind with truth, absolute truth, to defend yourself against thoughts, against all sorts of evils that this world and the Satan and his kingdom will bring to you. But thank Jesus, his kingdom's going to fall one day forever. And to him, Jesus, be all the glory and the praise and the honor. So questions to consider. Again, I want you to answer these as well. Name the lymphoid tissue that protects epithelia lining the digestive, respiratory, urinary, reproductive tracts. Okay. Define tonsil. So define that. Name the 5 tonsils. We already talked about that. And then trace the path of lymph through a lymph node beginning at the afferent lymphatics. Okay, the afferent part. Lymphoid organs. So lymph nodes are the first ones. And let me show you some pictures here. So for example, here's some lymph nodes in the cervical region. You can see the salivary gland and just all this lymphatic, capillaries and vessels, and then lymph nodes. There's various lymph nodes everywhere right here. You can see some in the armpit, axillary lymph nodes. Here's some in the groin region. Again, all these guys are the slow pat down lane, right? We're trying to closely inspect the blood and what's in the blood to help protect our bodies from infection. So let's talk about 2 organs, and then we'll call this video a wrap. I guess that's what they call it in video terminology. It doesn't matter. Okay, anyways, the thymus. The thymus is an amazing organ. It lies posterior to the manubrium. So if we were to dissect the cat, you would take out the chest bone, and underneath you would find a thymus. And it was really cool because the size of the thymus actually helps you understand how old the cat was. Because the thymus, your thymus, is a lot larger than my thymus. I don't know about like a lot, but it is. And especially if someone who's 50 and 60, because the maximum size happens around puberty. I know you're past that, but that is still, yours is still a lot larger. So the thymus is very important. Greatest size by age, 1 or 2, and then reaching maximum size by puberty and then diminishes. So it's slowly diminishing. So what exactly does the thymus do? It produces hormones, but it's also closely related to the immune system. The thymus serves as a vital role in the training and development of T lymphocytes or T cells. Basically, these are where the T cells understand their job. An extremely important type of T cells defend the body from potentially deadly pathogens such as bacteria, viruses, and fungi. So again, we want these guys to be able to do their job well, the T cells, and the thymus helps them do that. Several hormones are produced as well. Now, the mature T cells circulate through the body where they recognize and kill pathogens. Obviously, that's good for us. Remember, pathogen is something that causes suffering. Pathos means suffering. Gen means beginning. They activate B cells. So if T cells aren't made correctly, B cells don't produce those antibodies that help target things for destruction. And they store the memory of past infections, which is where vaccines come into play. Of course, the whole world is waiting for a COVID-19 vaccine right now. Unlike most organs, the thymus enlarges through childhood, but slowly shrinks from the onset of puberty. It's replaced by adipose tissue. So again, the shrinking is due to the reduced role of the thymus in adulthood. The immune system makes most of its T cells during childhood and requires very few new T cells after puberty. So it's very important, of course, in development. So here's a good picture of it. Let me take this away. So there's a picture of it. So behind the manubrium, part of the sternum, left lung, heart, right there above the heart. It would have been, it's interesting to see in the cat. Here's a clinical application. I know we already talked about this when we talked about the muscular system, but myasthenia gravis. Autoimmune, which means the immune system is attacking your own body. I know someone who has an autoimmune disorder, actually multiple people, and it's like the body's attacking itself, which is really kind of crazy to think about, but that does happen sometimes. And so ACH, remember ACH? Receptors are destroyed, therefore it can't bind, so the signal to contract is not there anymore. And so symptoms can include difficulty swallowing, double vision, unsteady walk. But this is associated with a hyperactive thymus. Hyperactive, which means these cells are going well beyond what their normal role should be. Now, the last thing we're going to talk about today is the spleen. The spleen is the largest lymphoid organ located on the left edge of the stomach. So it's kind of hard to see, but left side of the body, stomach's on the left side of the stomach. It consists of the following, areas or regions: the diaphragmatic surface and the visceral surface. Let me show you a picture here. So here's a picture of the spleen. Here's the external appearance. You can have obviously vein and artery, vessels, the gastric area, renal area. And so there's two different types of pulp associated with the spleen I want you to know about. Pulp are cellular components within the capsule, within a specific place in the spleen. Red pulp contains large quantities of red blood cells. That's helpful to remember. Also contains macrophages, which are cells that ingest foreign particles or other types of cells. White pulp resembles lymphoid nodules with lymphocytes. Okay, so you have two different types of pulp within the spleen. And this slide right here, I'll take away the webcam, but I'm not going to go over this. But if you want to pause right here and read over this, but this just kind of goes more in depth into red pulp and white pulp. But I do want to read the last paragraph for you, or at least go over it. The spleen is not a vital organ. I actually remember a student in my past telling me that she had her spleen removed. And I was like, oh, what does that mean for you? And that's part of your questions at the end of this. I want you to look up what happens when you get your spleen removed. Can you play contact sports? What happens? What are you more prone to? It's interesting. Expunctions are useful but not necessary. So the spleen, again, is filtering, blood vessels, recycling blood functions of the spleen in its absence. But it's so soft, spongy, and vascular. Damage to the spleen is almost always, here it is, treated by its complete removal. Untreated damage to the spleen can quickly lead to massive internal hemorrhaging, which is bleeding and eventual death. So that is some questions I want you to consider as we wrap up this video. What happens when a spleen is ruptured? Like, what type of activities does this involve usually? What exactly happens when it's ruptured? Is it like, where does it rip, or is there more of a common spot where it is damaged? And then if someone has to remove their spleen like my friend did, what are they, or he or she, more susceptible to? How do they have to change how they live? So the spleen, not vital, but helpful. And so I hope you to benefit from looking those questions up. So in the meantime, guys, I hope this video was helpful. I hope I was clear and concise with it. But if you have any questions, please reach out to me. Until next time, I hope you and your family are well and at peace. Again, I wanted to bring it up again. Make sure you're in the Word. It's so important to hear from God, and He's given us His good word for us to read. So yeah, let me know. Hope this was helpful. God bless.